Now from Lancaster University in the UK is virologist and vaccine expert Mohammed Munir. Mohammed, it's good to see you again. We've talked so many times about possibilities for extending vaccinations to more age groups. Now we've got Cuba. They're vaccinating children as young as 2. What's your take on this? I mean, talk to me about safety and efficacy.
Well, thank you very much, Brent, for having me on the show once again. There are 5 vaccines that are currently being investigated within Cuba. One of them is Abdala, they call it Abdala, and the other 4 are within the series of Soberana. Both these vaccines are subunit adjuvanted vaccine, which means that they take the spike protein of the coronavirus and harvest in the bacteria, and then add some of the toxins to induce the immune system. These are very established technologies. Novavax is based on this technology, which is, of course, approved within India and is being considered to be approved in other nations as well. Easy to produce, cheaper to produce, and based on the results that are publicly available, Cuban government regulatory authority called CMED, they state that both of these vaccines have more than 90% efficacy, either in 2 doses or 3 doses regime. But that is based on their own statements. There is literally no or little information in public, in peer-reviewed journals. Therefore, it is a little hard to really investigate at the independent level.
Yeah, and that's why the World Health Organization has not recognized these vaccines yet. But could Cuba be a test case for the rest of the world to watch and learn from?
Absolutely, that is the most important aspect that I am really interested to see, because, well, at one moment it is great that children are being vaccinated at that end, but on the other hand, this is really a testament that because if anything, God forbid, goes wrong over there in Cuba, the vaccination campaign for the children is going to be really scum, and not only within the America, but also in the rest of the world, because that would be taken as a testament. And we know there are many diseases such as the respiratory syncytial virus, for example. There are excellent vaccine candidates, but none of them has been approved. It's just because in the initial trials, those didn't go well in children, and afterward the whole program was really taken on knees. So it is really important aspect that we need to look very carefully on administering children at an age of 2.
Yeah, it's very important. It's also important that we increase the number of people who are getting vaccinated. We understand there are reports that the U.S. president will perhaps tonight or tomorrow call for a global vaccine summit. I mean, we can get our shots here in Europe and North America, but only 3% of Africans are fully vaccinated. I mean, that is a scandal.
I think this is really unethical and unacceptable, because if we really look on to the developed nation, they have surplus of 1.8 billion doses that they don't really need, and that is more than enough to vaccinate the whole of Africa, which is having a population of 1.2 billion. And I mean, even with the COVAX program, 76 million has been promised to Africa, but at the moment it's only 15% of that has been provided, which accounts only for 20% of the promise one. And at this moment, the vaccine coverage is significantly low, and at least 729 million doses are required to vaccinate at least 30% of the population of Africa by the end of this year. All that cannot be done by all the promises that are being made. Need some practical actions.
Let me ask you about Moderna. Moderna is reportedly working on a 2-in-1 vaccine, COVID-19 and the flu vaccine in one jab. Now, this is becoming more important here in the Northern Hemisphere as we head into fall and winter and flu season, right?
Yeah, absolutely, it is very important. And I think by the time we've been into this pandemic, it has become now clear that it's going to be an endemic infection, that we need to have a booster dose almost every year. And I think it's a clever idea to combine with the influenza vaccine, because that is being administered anyways. However, there are major challenges, Brent, that I want to highlight. One major challenge is that our vaccine for influenza is always trained by the last 2 years of sequence information of the influenza. But since we didn't really have infection in the last 2 years, our best bet might not turn out to be as good as we used to have with the influenza. So certainly there are a lot of challenges with combining doses, and also in which hemisphere we look into. So, but generally speaking, it's a very good idea to combine both doses and both vaccine into the single shot.
And it may be a good idea this winter, again, to wear those face masks because they do protect against all those viruses. Virologist Mohammed Munir from Lancaster University. As always, Mohammed, good talking with you. We appreciate your insights. Thank you.
Thanks for having me.